Of course, the most common splint which is kept in the exam and which inevitably the examiners will ask you is your club foot brace, otherwise it's called as a FAB, that is the orthosis used in club foot to keep the limb in external rotation, and as well as to maintain the deformities what you have got corrected, you use the brace. So first in a CTEV you correct the deformity by your Ponseti technique, that is serial casting, and then over a period of time the foot deformity, that is talipus equinovarus, that is the equinus at ankle, varus the heel, and midfoot cavus and forefoot reduction, all you get corrected by serial casting by Ponseti technique. And once the correction is complete, if you leave the child is going to come back to you with a recurrence of the deformity. So to prevent a recurrence of the deformity, you need to give him a brace or you need to give him a splint, so that whatever correction you have achieved is maintained till the child starts weight bearing. And once the child starts weight bearing, the weight of the body itself will correct the deformity and recurrence will not occur. And once a child starts bearing weight, we don't use these braces. We use the modified shoe, which I'll describe you subsequently, which will help in preventing a recurrence of the deformity. So till the age of walking, that's about 11 months to 13 months, you give these brace. So these are called foot abduction brace or FAB. So usually they will keep the foot in 60 to 70 degrees of abduction, as you can see here, and 10 to 15 degrees of dorsiflexion, so that the equinus does not come. So these are the two characteristics of this brace, which are attached by a rod. This brace not only keeps the corrected foot in the corrected position, and as the child starts wriggling and kicking the foot, one will help the other in correcting and maintaining the correction what he has used. So this needs to be worn continuously for 3 to 4 months, or sometimes till patient starts take walking, when you can replace them with the CTV shoes. So this is the classical listing. The principle here is the foot is kept in abduction, and the abduction is about 60 to 70 degrees, and then there is a dorsiflexion of 10 to 15 degrees. So this is the FAB brace, and you have a lot of modifications of this FAB brace. One of the modification of foot abduction brace is your Denis Browne splint. This is the most common splint used in children of CTV is corrected. And as you can see, this has two CTEVs connected by a rod, and this foot which is treated is kept in 60 to 70 degrees of abduction.